is Dr. Vandna Jerath, and she's going to talk about women's health AI, practical utilization in a clinical ObGyn setting. So, welcome. Thank you.
Hi, everybody. Thank you for hanging in there. I know it's getting to be a long evening, but hopefully you're learning a lot of good, valuable information. Such great speakers already, so there's just a lot out there with AI evolving and developing. So, as Margie said, I'm talking about the practical utilization and application of AI in a clinical setting. So I actually use AI currently in my private practice. So this is just a really busy slide. You don't have to read it. I'm a solo ObGyn physician in private practice in Parker. I have multiple leadership roles, and I do consulting and advising. I'm an advisor for Perio Health as well. And I think the biggest thing about me is, I'm what do they call it, a small fish in a big pond, right? And so I think I've always had to innovate, and so I'm an early adopter of innovation. So to survive solo practice in this day and age of healthcare, modern healthcare, I think you have to innovate and you have to keep growing and evolving. So I think that's one of my strengths. All right, Margie also went over our learning objectives already, so I just kind of put it up there for you for a second. So, is AI the future of healthcare? Dr. Viktorov crossed that off on his title slide. So, I'm going to argue that I think it is, but not entirely, right? I don't think AI can ever replace a physician or a provider, but we need to embrace it. It's like the title of our program tonight, it's coming whether you like it or not. So AI perception, this is a Pew study, and it says fewer than half in the United States expect AI in health and medicine to improve patient outcomes. And then Americans are more concerned that healthcare providers will adopt AI too quickly. Also, 38% of patients feel using AI in healthcare would lead to better health outcomes. 40% think it will reduce the number of mistakes made by healthcare providers. And 51% think it would improve the problem of bias and unfair treatment. And I think that is really debatable. There's a lot of data actually already out there saying that AI does carry over biases that already exist. So I'm going to talk about the practical utilization of AI. I'm going to talk about three areas that I use in my practice. So one is ChatGPT. The next is AI scribes or ambient documentation, as Steve and Maggie talked about, and then using a virtual assistant and voice over internet. And also, to go back here, that little setup is so I have a front desk that is completely virtual. I no longer have a human. I have a human there, but she's on a screen. So she is actually a human, but she's in the Philippines, and she's on an iPad at the front desk. And I adopted this, just to clarify, 2 years ago out of necessity. It was the middle of COVID. I had an employee leave. I literally could not find somebody to hire. Especially at any type of affordable rate. So I had to do this out of kind of an emergency setup, and it was going to be temporary. There's actually, this original picture has a note up there saying why we did it and that it was just going to be temporary. Well, she worked out so phenomenally well, and my patients love her. I will never go back. So. All right, so let's talk about ChatGPT. So we've already kind of established it's an open AI platform. There's version 3.5 or 4.0. 3.5 is free. Version 4.0 has the bells and whistles. It's $20 a month. So I think the key in using ChatGPT, and I know Steve talked about this a little bit, is using good prompts. So that's really important, and that's where people don't know what to say or do. How do you use it? The first time I sort of presented AI to Margie, she's like, how did you do this? So you have to define your parameters. You have to create a role. So by creating a role, what I mean is I'll tell ChatGPT, act like an ObGyn physician. Be a women's healthcare consultant. Be an expert in menopause. So like I prompt it to do that, so then it's pulling that type of information. So, and then creating a goal, like what kind of outcome or measure do you want ChatGPT to get for you? And then you have to keep refining it, you have to keep narrowing it, and you have to keep adding detail. And then finally, you can't just rely on ChatGPT, you have to review it and edit it, okay? So, there should be, there's handouts on your table, so if you guys want to take a look at that. These are the prompts I put in to create, so this handout was created by ChatGPT. And then with me, of course, at the end, reviewing it and editing it. But it was created by ChatGPT. And these are my exact prompts I put in to create that handout. Act as a healthcare and AI expert and write a detailed list of ways to use AI to improve efficiency of practice in clinical care and healthcare. Include using ChatGPT for medical necessity letters and claim appeals along with other suggestions. Also include using AI scribes to write clinical progress notes. Do you understand? So you talk to ChatGPT. And then, so I said that, and then it tells you, yes, I understand. Or it'll tell you, no, I can't do this. It actually will say that too. So then it spit out something for me, and then I said, can you redo the list, adding a little more detail and perhaps an example of each item? So then I reviewed that. Then I said, redo the list with numbered item or category, then a brief description, and then a brief example. And then I said, one more time, redo the list, but with examples related to women's health. And then voila, there's your handout. So, and this took, I don't know, maybe 5 to 7 minutes, like not long at all. And I remember we had a education committee meeting, and Jane and Margie and I spoke, and then we were talking about doing this event, and so literally I got off the phone and did this and then emailed it to them immediately. And Margie was like, how the heck did you do that? So, okay, so these are women's health AI applications. This is all in your handout in detail, but I'll just kind of go through a few of them. So you can use it for diagnosis assistance. This is already being done for pap smears and cytology readings for pap smears, and also for reading mammograms currently for detecting masses. So this is already in existence. You can use it for predictive analytics for women's health, like, figuring out risks or for preeclampsia or preterm labor, using EHR management, which Maggie just talked about, and using it for ambient documentation, AI scribes, and I'm going to get into this in more detail in a second. Use it for telemedicine and virtual health assistance. It can actually, do a summary. Again, the breast imaging, so you can use it in imaging. You can also use it to detect fibroids. Medication management for women's health. It can set reminders for women. It can provide education. ChatGPT for women's health documentation, or if you're a single person like me, you can write your online dating profile. So patient engagement education, that's going to be one of my next steps in my practice, is to really use it. Like, I would love to get into chatbots and developing more education handouts. And then in healthcare systems, it can be used in resource allocation and bed management. Then the natural language processing for ObGyn research. There's already students. I do a lot of mentoring for med students and PA students, and they're using this for their research projects. They're already using ChatGPT, and especially to create their references, and then also to find information. But as Steve said, they have to read it, or I think Dr. Victorov said, you have to not plagiarize ChatGPT. You have to make it your own and show your own work. So also administrative task automation. I think this goes along with like the practice management RCM side. As Maggie said, using it for insurance verification, so it can be done for that. Again, the patient risk stratification, population health management, and then quality assurance and compliance monitoring as well. And this is another hot topic and debate in itself, of course. Clinical decision support systems. So this one is interesting. I think it's a positive and a negative. Like, it can help you process algorithms. So let's say you wanted an ACOG algorithm, you might be able to process that and determine a clinical decision. However, it also may spit out information that is compiled through Google and other research that may not be accurate. So the accuracy of this, I think, is still up for debate. Voice and speech recognition, continuous monitoring, and then you can use it for precision and genomic medicine as well. And of course, Dr. Victorov talked about data security. All right, so let's talk about AI medical scribes. This is the newest thing that I'm doing in my practice, and it has absolutely been a game changer. So it's advanced software programs that automate and streamline documentation. So the nice thing about this is now I can go in a room and no longer be typing, and I can focus on my patient rather than focusing on the computer. And it's really, improved that connection again. That's why we all went into medicine, right? Is the joy of medicine is that connection with our patients and being able to provide them care and transform their lives. So it recognizes speech and it uses the language processing to capture and transcribe clinical conversations. So it starts with a transcription, and Maggie and I are going to do a demo for you. So it starts with a transcription. It's just hearing the two of you talk, you and your patient, and then you hit a little button and it creates a SOAP note. It's magic. So So it takes that transcription and converts it into a SOAP note. And then what I'm adding here is that you have to edit it. So anybody who's taking these notes and just putting them in their EHR, I do think that's going to open you up for liability. I read every single one and I edit every single one. But that takes me seconds to minutes versus 2 hours of documentation a day. So I think it's really helpful. The programs, a lot of different programs out there. I copy and paste it currently into my EHR, and then like Maggie, I'm an advisor for Maggie's company, so we've talked about the product I use, and she's actually integrated it into her EHR now, which is fantastic. All right, so things to consider. Accuracy is the number one thing, right? Is it transcribing the correct conversation? So the first time I started using it, I was like, wow, this is amazing, because it would filter out anything that wasn't medical. So if I was like, hey, how was your vacation? How was your trip to Mexico? It would filter all of that out. So you're like, oh, it did transcribe it, but it didn't put it in the SOAP note, which was amazing. Like, so the AI could figure out what was medical and clinical information. The longer you do this, it does have hiccups. So, to be fair, so I had COVID on Thanksgiving. At Thanksgiving, I was quite sick for a month. So when I returned, and I missed 2 weeks of work, so my patients knew that. So when I returned, they were all like, I heard you had COVID, are you okay? And my patients know I've been very diligent about it because I have a very immunocompromised father. So they were like, are you okay? And all of this stuff. So they're asking about my COVID and my symptoms. So I'd say I had a cough, I had a fever, I had this. It started putting that in the notes. So the week after I had COVID and come back to work, all the notes were wrong. Because it took my history instead of the patient history. So that's an example of where the accuracy is really off. Speed is important too. So there's different products out there and they all work at different speeds. And some of them, you'll hit a button to convert it to your SOAP note, and some of it will do it immediately, some within minutes, and some can take another day to do that. So that's really important if you evaluate products. And then whether it integrates with your EHR or not. Mine does not. Like I said, I copy and paste, but Maggie's product, it does integrate. And then customization. So do you have the ability to customize the note? How easy is it to do that? And that's key. You have to be able to customize the notes. And then the cost, like how much do these products cost? So Nax Duance, is considered all bells and whistles, top of the line. That's about $1,000 a provider a month. So very, very expensive. There are free versions out there, and then there's anything in between for that cost spectrum. The products that I kind of demoed and looked at and am using is about $100 a month. So, and then overall comfort and efficiency. How comfortable are you using this product? Do you feel comfortable with the transcription and the notes that it's creating? I think that's really key too. All right, so this is just a list of multiple different products. I use the top one, Nabla. I demoed Nabla and Freed both, and I like them both. The thing I didn't love about Freed was that it's made a lot of clinical decision making and gave you advice, right? And I was like, ooh, don't tell me how to practice medicine. So I wasn't ready for that. At some point, I may be ready for that. I just wasn't ready for it yet. And Nabla does a straight transcription and just creates a note, and I found that more beneficial for my needs. But what I really love is I don't have to take notes in the room anymore. Right? I don't type anything, I don't write anything. That's fantastic. And like I said, Nuance, top of the line, but very, very expensive. And then some of these other products actually don't transcribe the same day. Sometimes you have to wait hours or the next day to get the transcription. So then you're kind of going back, right? You have to refresh your memory on your patient. So that can be difficult too. And then Amazon is getting in on the market. So Amazon Web Services has created a product called Health Scribe. All right, so the third way that I'm using AI in my practice, so I already told you guys about my medical virtual assistant and the remote setup that I have. So she's in the Philippines. So she answers, to give you an idea of what she does, she answers my phones, she does all insurance verifications, she checks in and checks out patients. So in answering the phones, we forward our phone lines now to voice over internet. We have a certain company, certain product, and it creates AI messaging. So she can be on the phone and it'll create an AI message of the next patient, just like our phones do, just like the iPhones do transcribe. You can have a transcription of the phone call, but it's in real time so she can see it, so she can be on the phone with one patient and then she can see the next patient calling and leaving a message, and it's in real time transcription. So that way I've never gotten so many compliments on how quickly she returns phone calls. way more than I ever did with a human sitting in the office, because I think she can see that. So she's processing one patient and she's already going on to process the next. And sometimes, because we also can text our patients, she can then text patients if there needs to be something done. So she's incredibly efficient and productive. So it really improves the efficiency and documentation. She also can copy and paste that if it doesn't have errors, or she can adjust it, and she can put that in the EHR, like if she needs to document a message. All right, and then I think the next step, like I said, that I would like to get into, and I actually know there's some practices doing this. There's a surgeon in town. I had checked out her website, and she's using AI chatbots already. So AI chatbots, both on your website and then also for phone triage, I think is going to be the next step. So I'm going to start exploring that as well, but I don't do that yet. All right, let's talk about pearls and pitfalls. You've heard a few already. So kind of the advantages of pearls are improved productivity and efficiency. You're more focused on the patient. I think I'm much happier. Patients are more engaged and they're more satisfied. Less documentation time. And then I think it was Steve that mentioned you can have accessible and affordable healthcare for patients. So, you could have PAs using AI assist, taking care of maybe a more complex patient population that they wouldn't be able to take care of otherwise. More independent APPs, and I put this in both the pearls and pitfalls. I put it on both sides because I think there's an argument for and against this. Diagnostic assistance, something I've talked to Maggie about is trying to maybe incorporate ACOG algorithms so that you don't have to look them up, like if you want to know what hypertensive protocol there is for preeclampsia with severe features, that it would be built into your EHR, which would be great because it'd just pull it up so you wouldn't have to look up a protocol. And then I put these two as question marks because there's arguments for and against this, that improves the quality of care and lowers healthcare costs. And that's certainly, part of the quadruple aim, and we want to do that, but this is still being researched and needs more time to figure out if this is actually the outcome. I think there are arguments for and against this. And then pitfalls is the how accurate it is there misinformation in there? Is there things that you have to constantly review and edit and change? What's the cost? Again, wide spectrum of cost, right? And there are some free versions out there too if you want to demo those. What's the learning curve of learning this? So that does take some time, and just like any technology, there can be hiccups, especially web-based technology and internet-based. Again, I put the more independent APPs, and then the bias and DEI. So this is another place where there's been some research published saying that the biases that we currently are trying to combat are carrying over into AI, and that sometimes AI goes down a rabbit hole in this realm. And so that to think that there's not bias is not accurate. And then data privacy concerns and regulatory and compliance issues, and a couple questions that maybe if we do a Q&A, Dr. Victoroff can answer. Maggie and I were talking earlier is, generally we're talking about what are the issues with AI, but specifically, like, would COPIC recommend that we sign a consent that we're using AI in our practice? Should we inform patients, one? And two, should a note at the end of the notes state, AI assistance along with like physician reviewed, something to that effect? So I'd love to pose those questions to you for the end. I'll just ask them now. And then what's the reproducibility of the results, and that, can AI predict the future? And obviously not, but those are all questions. So the studies that are out there shows AI's accuracy to be different in different studies. So that's part of it too. All right, there's a really good article just published this month in JAMA, and how to navigate the pitfalls of AI hype in healthcare. This is a lot of CMIOs that participated in this article. It's definitely worth a read, and it's very interesting. So just a couple quotes about AI. Progress is important, but so is proceeding with caution. The greatest opportunity offered by AI is not reducing errors or workloads or even curing cancer. It's the opportunity to restore the precious and time-honored connection and trust, and that's Dr. Eric Topol. My own quote that I'm going to add in here is, physicians and providers can't be replaced by AI, but we should judiciously embrace AI as a partner to enhance healthcare. All right, thank you.